welcome back to my channel. I found every day I found Diagnostic. If you're new to my channel, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with speeches, syndrome, and the like. So if you're liking some of my videos, please give me feedback by commenting below or smashing the like button. It would be much appreciated. So in this time of day, as we're nearing Christmas, even though I know I shouldn't be bringing up too much of the health and awareness, but as I said so many times before, I can't stress enough that I'll probably be out of action as of after New Year, so that's why I'm trying to bring you guys some informative stuff, hopefully based on health and awareness on autism and Asperger's syndrome, and hopefully mental health, and maybe a bit of fun and games along the way, especially for some of the stuff that has been held back of the Christmas vlogmas that I've been up to. Obviously will come of late, maybe after New Year's period as well, so be on the lookout for that if you're wanting some of that sort of stuff. And I'm hoping, as promised, maybe in this coming year to bring out some more bigging with the Aspie series. We'll just have to wait and see where it takes me for this year, obviously, and saying that. So this one's going to be another health related one. This one's called Intermittent Explosive Disorder. So just as a disclaimer, as always, before I begin this, I'm no medical doctor. I'm just your normal everyday Joe blogs that's sharing real life stories with Asperger's syndrome and the like. But if you see any of the warning signs and symptoms in regards to any of these disorders or what have you, seek professional help for yourself or your loved one, or seek an opinion for yourself or for your loved one, because I don't forever condone self-harm. So you may be wondering, what is intermittent explosive disorder? Well, as we know, that this is abbreviated down to IED, which is a behavioral disorder that is characterized by explosive outbursts of anger and violence, often to the point of rage that are disproportionate to the situation at hand. Example, your impulsive screaming triggered by relatively inconsequential events, or you're just yelling and screaming at your partner, trying to get your way with them, and all the name calling starts to begin as well. Impulsive aggression isn't premeditated, however, and is often defined as a disproportionate reaction to any provocation, real or perceived. Some individuals have reported, however, that there has been some affective changes prior to an outburst, for example, tension and changes of the energy, etc., etc. The disorder is currently characterized in the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, under the Disruptive, Impulsive Control and Conflict Disorders. Individuals diagnosed with IED report their outbursts as being brief, lasting less than an hour, with a variety of bodily symptoms such as your sweating, stuttering, chest tightens, twitching, palpitations, reported by a third of one sample. Aggressive acts are frequently reported accompanied by a sensation of relief, and in some cases pleasure, but often followed by later on remorse. Intermittent explosive disorder involves repeated sudden episodes of impulsive, aggressive, violent behaviors or angry verbal outbursts in which you react grossly out of proportion to the situation, such as your road rage, domestic abuse to your partner, throwing or breaking objects, or any other temper tantrums that may be signs of this disorder. These intermittent explosive outbursts cause your significant distress, negatively impact your relationships through work, school, your colleagues that you're working for or studying with and whatnot, and they can have legal and financial consequences. Intermittent explosive disorder is a chronic disorder that can continue throughout the years, although the severity of outbursts may decrease with age. Treatment involves medications and psychotherapy to help you to control your aggressive impulses, but not always the case. I'll share more later on. Explosive eruptions occur suddenly with little or no warning and usually last less than 30 minutes at a time. These episodes may occur frequently or be separated out by weeks or months of non-aggression. Less severe verbal outbursts may occur in between episodes of physical aggression. You may be irritable, impulsive, aggressive, or chronically angry most of the time. Aggressive episodes may precede or be accompanied by the following: rage, irritability, increased energy, racing thoughts, tingling, tremors, palpitations, chest tightness. The explosive verbal and behavioral outbursts are out of proportion to the situation with no thought to the consequence that may include the following: temper tantrums, tirades, heated arguments, yelling, shouting, slapping, shoving or pushing, physical fights, property damage, threatening or assaulting people or animals. You may feel a sense of relief and tiredness after these episodes. Later, you may feel remorse again, regret or embarrassment. You may be questioning when to see a doctor. That is a good question. If you recognize any of the signs or your own behaviors in the description of intermittent explosive disorder, as I shared before, talk with your doctor about treatment options or ask for a referral to a mental health provider if need be. The causes for this. The exact cause of intermittent explosive disorder, however, like many mental health disorders, some of them are classically unknown, but it's probably caused by a number of environmental and biological factors, however. This disorder typically begins in childhood after the age of 6 years or during adolescence and is more common in people under the age of 40. The environment also may be a cause factor, as I said, basically. So in saying this, most people with this disorder grew up in families where explosive behavior and verbal and physical abuse were quite common. So they tend to obviously intimate and copy these type behaviors. Being exposed to this type of violence at an early age makes it more likely that these children will accept these same traits as they mature in age. Genetics. There may be a genetic component causing this disorder to be passed down from parents to children, however. As well as the brain chemistry, there may be differences in the way serotonin, an important chemical messenger in the brain, works in people with intermittent explosive disorder. Risk factors. These factors may increase your risk of developing intermittent disorder. History of physical abuse. People who are abused as children or experience multiple traumatic events have an increased risk of this disorder. History of other mental health disorders. People who have antisocial personality disorder, borderline personality disorder, or other disorders may include disruptive behaviors such as attention deficit hyperactivity disorder, ADHD, which then has a high increased risk of also having this disorder. Complications. People with intermittent explosive disorder may have an increased risk of impaired interpersonal relationships. They are often perceived by others as always being angry and can't shake off this feeling. They may have frequent verbal fights, or they may even come to a time of physical abuse towards others. These actions can lead to relationship problems, divorce, or family stress. Trouble at work or home or school. Other complications of this disorder may include job losses, school suspension, car accidents, financial problems, or trouble with the law. Problems with mood. Mood disorders such as depression or anxiety often may occur with this disorder. Problems with alcohol and other substance abuse. Problems with drugs or alcohol often occur with this too. Physical health problems. Medical causes are more common and can include, for example, high blood pressure, diabetes, heart disease, stroke, ulcers and chronic pain. Self-harm. Intentional injuries or suicidal attempts may often occur as well to this. Prevention. If you have this disorder, prevention is likely beyond your control unless you get treatment from a medical professional team. Combined with or as part of a treatment plan, these suggestions may help you prevent some incidences from getting out of control. Stick with your treatment. Attend your therapy sessions, practice your self-coping skills, and if your doctor has prescribed any medication, be sure to take this. Practice relaxation techniques. Regular use of deep breathing, relaxation, imagery, or yoga may help you to stay calm. Develop new ways of thinking. This is called cognitive restructuring. Changing the way you think about a frustrating situation by using rational thoughts, reasonable expectations, and logic may also improve how you view and react to certain events. Use problem solving. Make a plan to find a way to solve a frustrating problem that occurs or arises. Even if you can't fix it right away, it can refocus your energy. Learn ways to improve your communication methods. Listen to the message the other person is trying to share with you and then think about your best response rather than saying the first thing that pops into your head straight away. Change your environment. When possible, leave or avoid situations that upset you or triggers you. Also, schedule personal time may enable you to better handle any upcoming stressful events or frustrating situations. Avoid mood-altering substances. Don't forever use alcohol or recreational drugs. Diagnosis. DSM-5 diagnosis for this criteria obviously will include recurrent outbursts that demonstrates an ability to control impulses, including either of the following that I'm about to describe: verbal aggression, tantrums, verbal arguments or fights, or physical aggression that occurs twice in a week-long period for at least 3 months. And doesn't lead to destruction of property or physical injury, which is in the criterion A1. And criterion L2, 3 outbursts that involve injury or destruction within a year-long period is in that criteria. Criterion B is aggressive behavior is grossly disproportionate to the magnitude of the psychosocial stresses. And criterion C, the outbursts aren't premeditated and serve no premeditated purpose. The outbursts cause distress or impairment of function or lead to financial or legal consequences, which is in your criterion D. Criterion E, the individual must be at least 6 years old. The recurrent outburst cannot be explained by another mental disorder and not the result of another medical disorder or substance use. Criterion F. It's important to note that the DSM-5 now includes 2 separate criteria for types of aggressive outbursts, A1 and A2, which have empirical support. Which in criterion A1, episodes of verbal and or non-damaging, non-destructive or non-injurious physical assault that occur or average twice weekly for 3 months. These could include temper tantrums, tirades, verbal arguments, fights, or any assault with any damage. This criterion includes high frequency, low intensity outbursts. And on the other hand, criterion A2, more severe destructive assaultive episodes which are more infrequent and occur on average 3 times within a 12-month period. These could be destroying an object without regard to value, assaulting an animal or individual. This criterion also includes high intensity, low frequency outbursts. The diagnosis for the DSM-5 in the past of this criteria for IED were similar to the current criteria. However, verbal aggression wasn't considered as part of the diagnostic criteria. The DSM-5 or 4 was characterized by the occurrence of discrete episodes of failure to resist aggressive impulses that result in violent assault or destruction of the property. Additionally, also in the degree of aggressiveness exposed during an episode should be grossly disproportionate to provocation or precipitating psychosocial stressor and or previously has stated. Diagnosis is made when certain other mental disorders have been ruled out, e.g. a head injury, Alzheimer's disease, etc., or due to substance abuse or medication. Diagnosis is made using a psychiatric interview to an affective and behavioral symptoms, the criteria listed in the DSM-4. However, this has been very specific in its definition of this disorder, which was then defined essentially by exclusion of other conditions. The diagnosis required here, though, however, is the degree of the aggressiveness is grossly disproportionate to the circumstances of provocation, and the episodic violence can't be accounted for by another mental or other medical condition. Differential diagnosis. Many psychiatric disorders and some substance use disorders are associated with increased aggression and are frequently comorbid with IED, often making this diagnosis of the differential one difficult. Individuals with IED are on average 4 times more likely to develop depressive or anxiety disorders and 3 times more likely to develop substance use disorders. Bipolar disorder, however, has been linked to increased length of agitation and aggressive behavior in some individuals, but for these individuals, aggressiveness is limited to manic and or depressive episodes. Whereas individuals with IED experience aggressive behavior even during periods with a neutral or positive mood. In one clinical study, the 2 disorders co-occurred 60% of the time. Patients report manic-like symptoms occurring just before outbursts and continuing throughout. According to a study, the average onset age of IED was around 5 years earlier than the onset age of bipolar disorder, indicating that the possible correlation between the 2. Similarly, alcohol and other substance use disorders may exhibit increased aggressiveness, but unless this aggression is experienced outside of these periods of acute intoxication and withdrawal, no diagnosis of IED is given. For a chronic disorder such as PTSD, it's important to assess whether the level of aggression meets IED criteria prior to the development of any other disorders. In antisocial personality disorder, interpersonal aggression is usually instrument in nature, for example, motivated by tangible rewards, whereas IED is more of an impulsive, unpremeditated reaction to situational stress. Treatment. Treatment is attempted through both cognitive behavioral therapy and psychotropic medication regimes. Though the pharmaceutical options have shown limited success, therapy aids in helping the patient recognize the impulses in hopes of achieving a level of awareness and control of the outburst, along with treating emotional stress that accompanies these episodes. Multiple drug regimes are frequently indicated for IED patients, however. Cognitive relaxation and coping skills have shown preliminary success in both groups and individual settings compared to waitlist control groups. This therapy consists of 12 sessions, the first three focusing on relaxation, training, then cognitive restructuring, then exposure therapy. The final sessions focus on resisting aggressive impulses and other preventive measures. Cyclic antidepressants and selective serotonin reuptake inhibitors such as fluoxetine, fluoxamine, and sertraline appears to alleviate some of these psychopathological symptoms. But then, however, you got to bear in mind some of these, medications that you give, you always read the label and conscious of what other symptoms may come into play with this as well. And if you're really unsure about it, seek professional help with your doctor. Coping and support. Controlling your anger. Part of your treatment may include unlearning problem behavior. Coping with anger is a learned behavior. Practice the techniques you learn in therapy to help you recognize what pushes your buttons and how to respond in ways that may work for you instead of against you. Developing a plan. Work with your doctor to develop a plan of action of when you feel yourself getting angry. For example, if you think you might lose control, to try to remove yourself from the situation, go for a walk, call a trusted friend to calm you down. Avoid any alcohol or any other recreational substance use. These substances may increase aggressiveness and the risk of explosive outbursts. If your loved one won't get help, unfortunately many people with intermittent explosive disorder won't forever seek help or treatment. If you're involved in a relationship with someone who has this disorder, take steps to protect yourself and your children if there's children involved in this relationship. Just remember, the abuse isn't your fault. No one deserves to be abused. Create an escape plan to stay safe from domestic violence. If you see that a situation is getting worse and suspect your loved one may be on the verge of an explosive episode, try to safely remove yourself and your children, if again you've got any, from that scene. However, leaving someone with this disorder, explosive temper, can be dangerous. Consider taking the following steps if the emergency arises. Call a domestic violence hotline or women's shelter for advice, either when the abuser isn't home or from a friend's house. Keep all firearms locked away or hidden. Don't give the abuser the key or combination to the lock. Pack an emergency bag in case this does happen. This will include items you will need when you leave, such as extra clothes, keys, personal papers, medications, money, etc., etc. Hide it or leave the bag with a trusted friend or neighbour. Tell a trusted friend or neighbour about the violence so that they can be aware, so they can call for help if they are forever concerned when they hear some outburst. Know where you'll go and how you'll get there if you're feeling threatened, even if it means you have to leave in the middle of the night. You might want to practice getting out of your home safely. Come up with a code word or visual signal that means you need the police and share it with friends and family as well as your children. Get help to protect yourself from domestic violence. These resources may help police, your doctor, or the emergency room. If you're injured, doctors and nurses can treat and document your injuries and let you know what local resources can help you feel safe. The National Domestic Violence Hotline should be able to be there, as well as, Women's Refuge and anywhere else, as well as support groups. A counselling or mental health centre. Many communities often offer counselling and support groups for people in abusive relationships. A local court. Your local court can help you get a restraining order that legally orders the abusers to stay away from you or face arrest. Local advocates may be available and help to you to guide you through this process. You can also file assault or any other charges when and if appropriate. Preparing for your appointment. If you're concerned because you're having repeated emotional outbursts, talk with your primary care doctor or make an appointment with someone who specializes in treating emotional disorders, such as a psychiatrist, psychologist, or social worker. Here's some information about the appointment. What you can do. Before your appointment, make a list of the symptoms you're experiencing, including any that may seem unrelated to the reason for your appointment. Key personal information, including any major stresses that has arisen or any recent life changes, any medications, vitamins, supplements, or any other form of supplements that you may be taking, including the doses. Questions you may want to ask the doctor. Okay, some basic questions you may have to answer your doctor may include, why am I having these anger outbursts? Do I need to take any tests? If so, does these tests require any special preparation? Is this condition temporary or long-lasting? What treatments are available for me and what would you recommend? Are there any side effects from the treatments that you're giving me? Are there any alternatives to the primary approach that you're suggesting? I have other medical health conditions. How can I best manage these conditions together? Is this a generic alternative to the alternative medicine you're prescribing to me? How long does therapy take to work? Do you have any printed material I can have? What websites do you recommend? Don't hesitate to ask any other questions that you may have after these following. And also, on the contrary of the outbursts at hand, your doctors may expect from you, or what you may expect from the doctor is, your doctor is likely to ask a number of questions, so be ready to answer them and focus on the points you want to spend the more time on. Your doctor may ask the following questions. How often do you have these episodes? What triggers them? Have you injured or verbally abused others around you? Have you damaged any property while angry? Have you tried to hurt yourself? Have your outbursts negatively affected your family or work life? Does anything seem to make these episodes occur more often? Is there anything that helps you to calm you down? Has anyone else in your family been diagnosed with a mental illness lately? Have you ever had a head injury? So on and so forth. Well, this quickly ends a real short, brief overview, hopefully, of the intermittent explosive disorder. Smash the like button, comment below. Feel free to comment below if you have experienced some of these and what you do so that we can open the floorboard for discussion for others, so we can create an understanding awareness for us all. Don't have to. If you haven't done so already and you want to join me right now as a YouTube fan bam, feel free to smash the subscribe button while you're down there as well. And while you're down there, also turn on the notification bell to keep up to date with everything that I do. In saying this though, just to bear in mind, as I said before, allowing the pace as well as many other videos, that my schedule may subject to change as of after New Year's, and maybe only 3 days a week, Monday, Wednesday, Friday, instead of Monday to Friday. But we'll soon see once I get back from my well-deserved break, I feel. So no further ado, guys, share these videos around as well to create an awareness and understanding. Thanks for support, thanks for watching. Do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now.